Poland has a relatively low incidence of HIV compared to the rest of Europe, but the number of positive diagnoses is climbing dramatically. The number of reported infections has more than doubled in the last 4 years.
This year, we will likely see another record number of new diagnoses.
33-year-old Marcel learned he was HIV positive in 2024.
It's hard to describe. I couldn't sleep. I felt incredible panic and fear.
But why is the number of infections rising, and how can it be slowed down? Marcel is gay and part of Poland's queer music scene. He doesn't know how he got infected, only that it was someone he trusted.
Despite the panic I was feeling, I tried to tell everyone I'd been with sexually in the last 3 years, but I still don't know how or where I got it.
Now Marcel raises awareness about HIV. Until early February, he traveled the country wearing a mask and handing out copies of a personally written letter in public places. Today, he's in Wrocław in southwest Poland. His letter begins with the words, "To the guy who infected me with HIV." 2 QR codes lead to his music, in which he processes his journey with the virus. And to a free HIV rapid test.
I wish I'd been more careful.
Despite the rise in cases, only about 10% of Poles have themselves tested for HIV or other sexually transmitted diseases. Far too few, say the experts.
As long as people don't get tested or protect themselves, like with condoms, there will continue to be infections.
The problem is, only those who know they have been infected can start treatment.
If I'd found out earlier and started treatment earlier, maybe I wouldn't have emphysema now.
But why has the number of new HIV diagnoses been rising in recent years? Experts say one reason is that awareness of the extreme danger of the virus has declined since medication became available to treat it.
There is a lack of awareness, and many believe HIV doesn't concern them because they've only had sex with someone they know.
Medical staff report an increase in infections in young people. Risky behavior like chemsex, drug use during sex, is on the rise, according to an epidemiologist from Warsaw's Central AIDS Center. She criticizes the lack of health education in Poland. What was planned as a compulsory subject in school is now only voluntary.
Many parents are afraid to talk with their children about the subject.
But another reason for the sharp rise in HIV infections is the war in Ukraine. Poland took in 1.6 million refugees. Some were HIV-positive patients who were unable to continue their treatment and sought help in Poland.
I have to emphasize that we're not talking about thousands more cases. Poland still has a low infection rate.
The doctor cautions against social prejudice.
Here in Poland, we're trying to be very careful with our statements. We don't want to give the impression that every Ukrainian is carrying the virus.
Poland is now fighting back with awareness campaigns for young people and targeted testing. Free HIV tests have been available at family doctors since 2025, but so far, few have taken up the offer. Marcel hopes that his letters will reach people where they least expect it, in their everyday lives.
My great hope is that people will get themselves tested and stop being afraid of one another.
Until Polish society reaches that point, he plans to continue his campaigns so that the stigma fades and awareness improves.